Hi, my name is Katie Olson, and I'm a registered nurse with CHI Health Urology. Today I'm going to talk a little bit about urodynamic studies, also known as UDS. Urodynamics is a test that we do in the clinic that evaluates the bladder and its function. Urodynamics looks at the lower urinary tract system, specifically the bladder, urethra, and the sphincter. Urodynamics also measures the nerve of your muscle functions and informs us of your urinary flow rate. Studies are done on both males and females, and is for people who suffer from overactive bladder, urinary frequency, incontinence, and incomplete bladder emptying. When you come for your appointment, we will bring you to a private exam room. We'll perform a urinalysis to check for any infections and to ensure your bladder is fully empty before starting the test. Once completed, you'll be asked to be seated in a private testing station. 2 catheters will be placed, one inserted into the urethra up into the bladder, and the other inserted in the rectum. Both of these catheters are small and flexible, similarly sized to a spaghetti noodle. Each of these catheters will be measuring different pressure to interpret your results. In addition to the catheters, 2 sticky electrodes will be placed, one near your rectum and one on your knee. The catheter in the bladder will be hooked up to tubing and sterile water, which we use to fill the bladder throughout the procedure. The catheters and electrodes connect to a device that will be attached to a lanyard. This lanyard will be placed around your neck for the duration of the test. These electrodes will relay data to a computer screen, which will show a contraction in your bladder and abdomen. This will provide us with more information on the working and non-working mechanisms needed to urinate effectively. Throughout the test, you'll be asked to do different things like cough, push, or strain. In addition, you'll be asked questions in regards to when you feel the urge to void and when you cannot hold urine in your bladder any longer. When your bladder feels full, you'll be asked to urinate into a graduated cylinder, which will be placed under your chair. The graduate sits on a Uroflow machine, which measures the strength of your stream. This entire process is recorded on a nearby computer, which monitors how much fluid was instilled, at what point you felt the urge to void, if you experienced incontinence, and any ebbing and flowing of the bladder muscles and contractions. This is an in-office procedure that takes about 90 minutes to perform. There is no special prep before visiting. You don't need to stop any medications and are safe to drive yourself to and from the appointment. You may have some irritation with urination afterwards, with a small possibility of blood in the urine. This is due to irritation from the catheter that was placed. We encourage patients to push lots of fluids and call the clinic if you have any additional concerns. You will follow up with your provider a few weeks after this test to go over results and develop a plan of care.